Can you replace all medications with herbal medicine? Let's discuss. I know I talk a lot about how you can wean off of Big Pharma's medications and use herbal medicine to manage your health instead, but I want you to understand that there are a lot of nuances in this conversation. Herbal medicine can be supportive in some way for every person, no matter the condition. That I firmly know, believe, have seen, but that doesn't mean it can replace all medications. Some are truly life saving and necessary. And, I've spoken with folks who do not want to go off of certain medications because they improve their quality of life so much. This is totally fine too. We can always mitigate side effects with herbal medicine. So I share, my journey to weaning off of pills because I was not taking life-saving medications. It was medications for preventable conditions that could be corrected with lifestyle, dietary changes, mindset, and ultimately, all of my issues went away when I healed my childhood trauma. So that's my story, my experience. Now, for you, there may be more considerations. So I recently spoke with someone who asked, 15 years ago, I took a radioactive iodine pill for Graves' disease. I was told that the pill would completely shrink and eliminate my thyroid gland. I have recently adopted a plant based lifestyle full time. I want to know, is it possible to discontinue the thyroid pill and use herbs only? Such a good question. The short answer is no, but if you want to understand why it's a no, keep listening. This is an instance where the person does not have a thyroid, and there are no herbs, not that I know of at least, that provide thyroid hormone and therefore can replace what the thyroid does. So, what does the thyroid do? The thyroid gland is a butterfly shaped organ located in the front of the neck below the larynx. It's an integral part of your endocrine system. The thyroid plays an important role in so many functions: metabolism, growth, and development. The thyroid uses iodine from food to make two hormones, triiodothyronine and thyroxine, T3 and T4. So, a follow up question that this person asked when we spoke on the phone was, can I take sea moss instead? Another good question, because how many times have you heard that sea moss helps with thyroid issues? Sea moss can provide iodine that the thyroid needs in order to make T3 and T4. However, you still need a thyroid for this process. So unfortunately, while sea moss has many other benefits, as it relates to thyroid health, when someone doesn't have a thyroid, it's not going to be supportive in this area. So what can happen when someone who doesn't have a thyroid stops taking thyroid replacement hormone? Let's back into this. T3 is the active form of thyroid hormone. When T3 and T4 are released into the bloodstream by the thyroid, T4 gets converted by the cells to T3, and they travel to nearly every cell in the body, affecting all of the body systems. These hormones control the rate and intensity of so many physiological functions. They are critical to heart health, digestive function, metabolism, muscle control, brain development, bone development, and they're involved in our sympathetic nervous system response, our fight or flight response. So someone who does not have a thyroid and isn't taking thyroid replacement hormone will eventually experience hypothyroidism. Some of those symptoms associated with hypothyroidism include trouble sleeping, tiredness and fatigue, difficulty concentrating, dry skin and hair, depression, sensitivity to cold temperature, frequent heavy and painful periods, joint and muscle pain, lack of appetite, slow speech, high diastolic blood pressure, easy weight gain, elevated cholesterol, slow heart rate, and muscle weakness. That's just some, y'all. So, does synthetic thyroid medication come with side effects? Yes, all drugs do. But given what can happen when your body no longer has the capability to make thyroid hormone because you don't have a thyroid, you have to weigh the benefits and the risks of going off the medication. And in this instance, like I said, when you don't have the thyroid gland to produce an essential hormone that plays a role in so many functions in the body, not having a replacement means many other health issues will present. So in my opinion, the risk isn't worth it, but you can still use herbal medicine to mitigate any drug side effects. And there are natural and desiccated thyroid extract. There are other natural forms of thyroid hormone available. They're not plants, right? So these may be viable alternatives to synthetic thyroid medications. you do have options. Just be proactive. Ask your doctor about your options. But essentially, there aren't any herbs that we know of that will provide the body with thyroid hormone replacement. So it must be externally introduced. I hope that provided some context on deeper considerations as we navigate using herbal medicine, weaning off of certain medications. Let me know in the comments if you have any questions, if this was helpful. Thanks for tuning in.